with PAD being a clear indication of a person's risk for a heart attack, are there any recommendations in there for patients who have PAD for a doctor to recommend that they go for advanced cardiac testing as well?
That's a great question. So there are a lot of us out there now. The evidence is weak. So here we go. Again, going back to the guidelines and the evidence and the data, because there's always a lag, because the evidence takes many years to build. It's not like there's not the funding and the support is not very strong sometimes. As we're trying to build the evidence, but we know. I mean, you asked a beautiful question. In my practice, so now we are not talking about the guidelines. This is Mehdi Shishehbor. In my practice, if you are a patient that has PAD, in my mind, and there's a lot of evidence for this, by the way, you are at higher risk of having coronary disease. So I send a lot of those patients for calcium score, to be honest with you. And a lot of the patients that have PAD, they're not very active. Guess what? Because they get pain when they walk. So they indirectly modify their activity level because they don't want to have pain. They don't even know they're doing it. So I give you an example. I have a lot of patients that play golf. They come see me. I ask them, do you have any symptoms? Do you have any chest pain or shortness of breath? No, I'm doing great. I said, well, do you take the cart or do you walk? You play 18 hole. They said, I take the cart. I said, did you take the cart 2 years ago? They said, no, I used to walk. Well, why do you take the cart now? Well, it's easier, Dr. Shishehbor. I don't know. I would get tired. Well, that's symptoms. Why do you get tired? And then when I pushed, I was getting tired, a little bit short of breath. So I just take the cart now. I just thought I was getting, I was not fit. Well, why are you not fit? Well, because you're changing your activity level. See how, being a doctor is like cooking. You can just throw 2 eggs in a pan and just make a quick omelet, or you can be sophisticated and make a nice pasta. And, it's like anything else in life that we do, right? You can be very elegant and very sophisticated in your approach, or you can be just warming up a frozen food, So, and medicine is the same. Now, the truth is that the consequences are big. If you eat a bad food, like not a delicious meal is okay. Well, it wasn't delicious. But if you don't make the right diagnosis, patient can have a heart attack. They can have a bad outcome. So in our field, having sophisticated doctors that can delineate and dissect the diagnosis is very important. So to answer your question, yes, in my practice, I am very aggressive in doing coronary evaluation, even in asymptomatic patients who have PAD, because there is a lot of evidence that PAD and coronary disease, they go together, they're married together. And that, we need to be more vigilant in identifying coronary disease in patients with PAD.
Yeah, I was just having a conversation with a university cardiologist who said that fatigue is the new angina, and you need to ask the right questions to get the right answers from patients. And I think that that's not only perfect for the heart, but also for the legs. And when people end up calling, some PAD people asymptomatic, I always say, well, how are you defining those symptoms? Because there have been patients that we have worked with at the Global PAD Association who have been, stated as being asymptomatic. But when you talk to him or talk to her, just as you were saying, you ask the right question about the golf cart and what did you do 2 years ago? It's the same thing. Some people don't realize that over time they're doing less and less and less and less in order to prevent the onset of some sort of pain, some sort of symptom. And so you have to really ask in-depth questions to understand, well, are they truly asymptomatic, or are they just completely modifying their lifestyle so that they don't become symptomatic?
It's so common. It happens to us. It happens to me. I'll be honest with you. In the winter time, I don't bike because of the weather here in Cleveland. It's icy and cold and not very pleasant for road biking. When the season opens for biking, I want to be honest with you. My fitness is totally different. And I don't think of it. It's not like it hits me. I'm like, oh my God, I am totally out of shape, from a standpoint of my activity, but I don't think of it the whole winter time because I'm able to do my routine daily activity because I'm not pushing myself the way I do when I get on a road bike. And I think this is happening a lot with our patients. I think you hit a very important point here that we as humans are very smart and we subconsciously tend to change our activity level without even realizing that we are doing it.